a person who did 2 times ACL reconstruction on the right leg, 9 months before ACL reconstruction, second reconstruction was done. First reconstruction, ligament was insufficient and was laxed after an infection. After 1 year postponation, they did another ACL reconstruction. Now after 9 months, he came and asked me that I want to play again. Is it I'm fit for that? What was that next step? That was his goal. If these kind of persons comes to me, how I will proceed with the assessment and follow through. படுத்துக்கலாம் ஃபஸ்ட் தலைங்க வச்சுக்கலாம். First and foremost, I will check the muscle mass and ask the patient to, this left is unaffected, right is affected, and squeeze பண்ணுங்க. Yeah, there is a good amount of muscle mass. I can see visibly as well as terminal extension is coming up, and then same thing I'm asking him to do here. So I can see there is a slight reduction in the muscle mass, but terminal extension of the knee actively happening good, and passively I'm checking terminal extension again in the same position. So assessment principles, don't frequently change the patient position. Whatever the position the patient attained, maximally finish all the tests you can done. ஓகேங்களா, அங்கிருந்து corticeps muscle mass is slightly reduced, but slight difference is there, but it's okay. We have to further evaluate through written sports assessment to get more understanding about it. And then I'm asking the patient to lie on கூப்பர்படுத்துக்கோங்க. In a stomach down position, not significant difference I can visibly see on with through palpation in the posterior aspect of the leg muscle. And flexion, I will check the flexion unaffected side first. Bend பண்ணுங்க, maximum bend பண்ணுங்க. Good, completely touch பண்ணுறீங்க. குட், நல்லா இருக்குல்ல, எந்த டிஸ்கம்ஃபர்ட் இல்லைல்ல. ஓகே, இந்த காலம் மேக்ஸிமம் பெண்ட் பண்ணுங்க. See, there was a significant reduction in the knee flexion range of motion, and that was one of the factor which we have to improve. இங்கே கிராம்ப் எதுவும் ஆகுதா? இங்கே hamstring cramp ஆகுது. And I always ask if there is a restriction in the range of motion. Hamstring cramp can be significant factor for loss of or reduced amount of strength or force production at the muscle group. So I was completed with this test and enchukandukalam. So and I'm trying to notice any crepitus sound. I can feel it because of 2-time reconstruction in past 2.5 years suffered with this injury. Unaffected say knee extend பண்ணி நீட்டுங்க, மடக்குங்க. Okay, it feels good, nothing was there. Okay, slight rubbing sound or crepitus sound I can feel it. Let's proceed with that. நம்ம strength check பண்ண போகிறோம். அதில் உட்காந்துக்கலாம் சேர்ல. Basic strength of quadriceps. ஓகே, சிங்கிள் லெக் ஸ்குவாட் டெஸ்ட். ஆமாம், அப்படி கிராஸ் பண்ணிக்கோங்க. கிராஸ் பண்ணிவிட்டு இந்த காலை மேலே தூக்கலாம். மடக்க வேணாம், ரொம்ப மடக்குனா இங்கே கிராம்ப் ஆகும். ஜஸ்ட் மடக்கிக்கோங்க, லைட்டாக காலை பெண்ட் பண்ணிக்கோங்க. பெண்ட் பண்ணி வச்சுட்டு இந்த காலை மட்டும் வச்சு இந்த காலை கீழே படாமல் ஜஸ்ட் எந்திரிச்சு உட்காருங்க. குட்ங்க, உட்காருங்க. அண்ட் ஆல்வேஸ் கீப் இன் மைண்ட், when you do single leg squat, 1 or 2 reps for assessment purpose, quickly we are testing. If a person couldn't able to perform correctly, can be a skill oriented. This single leg squat also a skill oriented movement as well. The person couldn't able to perform better, maybe person not trained for the single leg squats movement. One more time பண்ணலாங்க. 1 or 2 times you can check. Okay, all good, உட்காந்துக்கோங்க. அண்ட் இந்த காலை கீழே வச்சுக்கோங்க. ஜஸ்ட் லிஃப்ட் திஸ் லெக்ங்க. ஜஸ்ட் மடக்கிக்கோங்க, லைட்டாக மடக்கி கால் மடக்கிக்கோங்க. ஃபைன், ஜஸ்ட் கெட் அப் அண்ட் சிட்டுங்க. I can see this significant difference in the balance as well as struggling to get up. உட்காரலாங்க. இன்னும் ஒரு டைம் ட்ரை பண்ணுங்க. சேம், பட் while performing it was good, and definitely ஃப்ரீ விட்டுருங்க. Definitely we have to go and do objective proper strength test, full max effort strength test to understand through crane scale max force production or repetition based test to understand this force production of the each muscle. Then I will move forward to hop test. அப்படியே நிற்கலாங்க. அங்கே நின்றுட்டுங்க, இடுப்பு கை வச்சுக்கோங்க. அப்படி ஹாப் பண்ணுங்க, 2 கால் ஹாப் பண்ணுங்க. So bilateral hop says that confidence is there, he was doing good. Then we can ask them to do the left leg only hopped. லெஃப்ட் லெக் மட்டும் ஹாப் பண்ணுங்க. லெஃப்ட் லெக் ஹாப். ஓகே, ரைட் லெக் மட்டும் ஹாப் பண்ணுங்க. Okay, this is to assess the confidence of the person. Basic thing, these are the basic thing which I am assessing the confidence of the person. And I forgot to do one thing is overhead squat, because I check the knee flexion in active knee flexion and loaded knee flexion also I have to check, so that overhead squat gives me the clarity, that movement clarity of mobility around the lower body, and how much he trained before. He has to grasp deep he can go or not, any ankle limitation, knee limitation or hip limitation present naturally, and what is his anatomical variation. So many things, training experience will get an understanding of the overhead squat. Overhead squat பண்ணுங்க. overhead squat he is doing good. இன்னொரு டைம் எந்திரிங்க. இப்போ பண்ணலாம் இன்னொரு டைம். Okay. There was a knee flexion restriction can visibly seen in the overhead squat எந்திரிச்சுக்கலாங்க. But rather than is good. It's not a problem. So this is a basic quick go through of test which I do regularly to get understanding of the person. Further, we have to go for the maximum muscle strength test as well as return to sports test of triple hop test, 6-meter hop test, lateral hop test on all to get more clarity about his return to sport test classification. So let's proceed the test and follow through more. If you want that long video of return to sport testing, we'll upload, comment below.